Good morning, students. Today's class is on thrombosis. What is a thrombus? A thrombus is a blood clot that is formed within an intact blood vessel from the constituents of blood. Coming to the formation of a thrombus develops due to three reasons. This was proposed by Virchow and is known as Virchow's triad. It includes endothelial injury, alterations in the normal blood flow, and hypercoagulability of the blood. Coming to endothelial injury, the important causes of endothelial injury are listed here. They include hypertension, turbulent blood flow, toxins, radiation injury, homocystinuria, hypercholesterolemia, and cigarette smoking. What exactly happens when there is endothelial injury is there is exposure of subendothelial collagen. This results in release of tissue factor and platelet adhesion, which results in the formation of a thrombus. Secondly, dysfunctional endothelium. There is increased synthesis of procoagulant factors and decreased synthesis of anticoagulant molecules, which results in thrombus formation. Secondly, coming to alterations in normal blood flow. Normal blood flow is laminar. When the laminar blood flow is disturbed, it results in thrombus formation. There are two conditions where this can happen. One is when there is stasis of blood flow, and secondly, when there is turbulence to the blood flow. Stasis occurs when there is slowing of circulation. What is the effect of stasis and turbulence in thrombus formation? In heart and arteries, turbulent blood flow causes endothelial injury leading to thrombosis. In veins, stasis leads to thrombus formation. Both promote endothelial cell activation and procoagulant activity. Stasis slows the wash out of activated clotting factors and the inflow of their inhibitors. Examples of conditions where there is stasis and turbulence are when there is an atherosclerotic plaque inside a blood vessel, the blood flow becomes turbulent. Conditions like aneurysm, myocardial infarction, mitral valve stenosis, hyperviscosity syndrome, like polycythemia and sickle cell anemia, there is stasis to the blood flow. Blood hypercoagulability is another important cause for thrombus formation. It can be divided into hereditary factors and acquired factors. Hereditary conditions which are responsible for thrombus formation include factor V mutations, antithrombin 3 deficiency, protein C deficiency, and protein S deficiency. Acquired causes include immobilization, myocardial infarction, cancers, prosthetic heart valves, DIC, heparin-induced thrombocytopenia, and antiphospholipid antibody syndromes. Low risk for thrombosis include cardiomyopathy, use of oral contraceptives, sickle cell anemia, and smoking. Coming to the morphology of a thrombe can form inside a blood vessel. It may be an artery or it may be a vein, or it can be formed in the chambers of the heart. When it is formed inside an artery, it is known as an arterial thrombe. And when it is formed inside a vein, it is known as a venous thrombus. When thrombi occur within the chambers of the heart, we call it as mural thrombi. Thrombi are usually attached to the vessel wall and they grow or propagate towards the heart. An important characteristic feature of a thrombus is thrombi are friable. When they become friable, they break up into pieces and they embolize. Arterial thrombi are usually gray-white in color, whereas venous thrombi are red in color because they occur at the sites of stages. Thrombi microscopically contains laminations known as lines of sand. Lines of sand has got a pale region and a darker region. The pale region contains platelets and fibrin, and the darker region contains RBCs. In the picture, you can see lines of sand. The dark areas contain RBC, and the light areas contain platelets and fibrin. The picture is showing the presence of a mural thrombi. A mural thrombi can develop inside the chambers of the heart, or it can form inside a large blood vessel. The most common cause of thrombus formation is its occurrence in deep veins of the leg. That condition is known as DVT or deep vein thrombosis. This usually happens because of pieces of blood. The differential diagnosis for a thrombus is postmortem clot. If you look at a postmortem clot, it happens after death. It has got a gelatinous appearance and it will form a chicken fat supernatant and it is not attached to the wall of the blood vessel. Thrombi that develop in the heart valves are known as vegetations. Common conditions where vegetations occur are infective endocarditis and rheumatic heart disease. These vegetations contain microorganisms, and when the vegetations do not contain microorganisms, they can be seen in SLE. Those vegetations occur in Lippmann-Sachs endocarditis. What are the differences between arterial and venous thrombi? If you look at the blood flow, arterial thrombi occurs in rapidly flowing blood, whereas venous thrombi occurs in slowly moving blood. Arterial thrombi are common in heart and aorta, whereas venous thrombi usually occurs in the deep leg veins. The cause of arterial thrombi is endothelial injury and turbulence, whereas the common cause for venous thrombi is stasis. Arterial thrombi propagate in a retrograde direction, whereas venous thrombi propagate in the direction of the blood flow. Other gross features and microscopic features of thrombi include arterial thrombi are gray-white, whereas venous thrombi are red in color. Microscopically, they contain lines of sand. This slide is showing the difference between postmortem clot and thrombus. As I have told you earlier, thrombi are friable and microscopically they contain lines of sand, whereas postmortem clots are gelatinous and they do not have lines of sand. They have a dependent part and they have a superficial part which appears like chicken fat. Thrombi are always attached to the vessel wall, whereas postmortem clot is not attached to the vessel wall. This slide is showing the fate of the thrombus. So there are four important fates for a thrombi. They include resolution, propagation, embolization, organization, and recanalization. Resolution is complete removal of the recent thrombi by enzymes. Propagation is thrombi may enlarge and become larger. Embolization means thrombi are friable, so they break up and they become an embolus in the circulation and goes around causing occlusions in various sites. Organization is inflammation and fibrosis, and recanalization is formation of new blood vessels within a thrombus. The picture is showing a thrombus and it is also showing recanalization. These are the references. Thank you very much.